Assalamualaikum. My name is Karul Izwan bin Kamrul Zaman and my other two members is Nur Hazwani binti Hussein and also Azifah Husna binti Muhammad Izri. Today we are going to present our final year project, which is predicting the length of stay in intensive care unit (ICU) and surgical ward after coronary artery bypass graft (CABG) surgery. Chapter 1: Introduction. Coronary heart disease (CHD) is also known as coronary artery disease. CHD begins to form as cholesterol builds up on the artery walls, forming plaques and causing the arteries to widen and restrict the blood flow to the heart. There are so many risk factors on developing CHD. Some of it is smoking, high blood pressure, high blood cholesterol, diabetes, overweight, and many more. The symptoms of CHD is chest pain where it spreads to jaw, neck, ears, arm, and wrist. The treatments to CHD is by involve making healthy lifestyle changes such as quit smoking, consume healthier diet, and also getting regular exercise. Also, medication and surgical treatment would be the treatments to CHD. Coronary artery bypass graft (CABG) surgery is one of the surgical procedures that perform better than any other surgical procedure. Also, there are a few types of CABG surgery. CABG patients will be taken to ICU or surgical ward right after the CABG surgery. For your information, ICU is a unit for patients that require high-tech equipment and close monitoring from the doctor. Meanwhile, for the surgical ward, it requires less monitoring compared to ICU. The problem statement. The predictor of length of stay in ICU and surgical ward is not very similar, but it may be influenced by certain chronic diseases. Also, longer ICU stays will limit ICU beds in a hospital. There are data mining technique was used by past researchers to identify the patterns impacting length of stay of patients, but the accuracy of the model was poor. The research questions: what is the best model to predict the length of stay in ICU and also surgical ward? And what are the significant factors that contribute to the length of stay in ICU and surgical ward? And the last one, is there any difference on risk factors that affect the length of stay in ICU and surgical ward? For the research objective is to model binary logistic regression models of length of stay in ICU and surgical ward for cardiac patients who undergo CABG surgery. Second, to identify the risk factors that affect the length of stay in ICU and surgical ward. And the last one is to compare the post-operative length of stay in ICU and surgical ward. The limitation to this study is time constraint as we are given only 14 weeks to complete this study. Also, due to the current COVID-19 pandemic situation and limited data source. The scope of this study is the total number of observation is 5,156, but only 3,538 of the patients undergoes CABG surgery, and the patients were split into two groups, which is ICU and surgical ward. And the period of the data is from 2007 until 2010. And the significance of the study is this study can give more information about risk factors that are associated with length of stay of cardiac patients who undergo CABG surgery. Next, this study can benefit the anesthesiologist and department to predict the length of stay for cardiac patients. The third one is to alert the society with more information regarding CHD, CABG surgery, and the length of stay in ICU and also surgical ward. And the last one, to compare the predictive model to predict the length of stay in ICU and surgical ward. Chapter 2, Literature Review. The first one is CABG. Casper et al. Found that CABG is one of the methods to reduce the risk of death in cardiac patients. The risk after surgery is increased in the first 30 days after the surgeries. Also, there are findings about CABG where there are minor and major complications after CABG surgery, and people who undergo the surgery need to stay in hospital for 7 days and have a full recovery 12 weeks after the surgery. Next is length of stay in ICU and surgical ward. Chan et al. Found in their study that the lengthy ICU stays of patients with spontaneous intracerebral hemorrhage was described as more than 10 days, while Li Wang et al. Found in their study approximately 28.4% of the patients were at low risk and 1,230 patients had long-term of length stay. Next, binary logistic regression in medical field. Hussein et al. Used binary logistic regression in their study to determine the significant factors associated with a surgical failure in different types of strabismus, while Peter et al. Also used PLR model to investigate the impact of obesity on developing those complications, adjusting for patient age and level fuse. The overview methods of CABG patients in length of stay in ICU and surgical ward. Pagan et al. use a multivariable log binomial regression model to examine the joint effects of post-operative length of stay. Also, Carmelo et al. Used multivariate logistic regression analysis to evaluate the impact of the variable identified as primary risk factors. Next is the application of binary logistic regression in predicting factors of CABG. Muhammad et al. Found that diabetes mellitus, amiodarone statin, amlodipine, and hyperlipidemia have been substantially associated with 30-day remission consequently. And the other study found that age, race, deprivation, and partnering are the key patient-level variables with stroke comorbidity.
In methodology chapter, we will explain the method and analysis used. Single-center retrospective analysis used in this study. The analysis will be performed 5,156 cardiac patients who undergone CABG surgery from 2007 to 2010. This analysis also used secondary data. The study focuses on a few categories such as gender, age, hypertension, and plenty more. This is a study framework where it shows the relationship between independent variable and dependent variable. The table shows a description of data where it contains of variable name, model rule, measurement level, and description of the variable. Next, we move to data preparation, where in this study use outliers. Outliers is a mean extreme statistical values. Outliers often occur and there is a few different processes to manage. This approach will compare the difference of value between mean and 5% mean if the data trimmed for both lower and higher end. As for the binary logistic regression, where the objective is to estimate the probability that an event occur. The equations show logi equation. The assumptions are the dependent variable must be dichotomous. Second, no multicollinearity exists. Third, the observation must be independent from each other. Fourth, there is a linear relationship between log odd and continuous predictor variable. And the last one requires large sample size. There are two types of interpret regression coefficient, which are logi and odds ratio. There are a few ways to describe the strength of the predictor variable towards the model. The first method is dividing R². This method shows how much the total variation in response is explained by the predictor variable in the model. The highest the R², the better model fits your data. And for the adjusted variance R² also can be used. This method is useful for comparing the model with different number of predictors. Next, the world statistic is the ratio of the square regression coefficient to the square of standard error of the coefficient and asymptotically distributed as chi-square distribution. So here is the step of assessing the significant input. In binary logistic regression, confidence intervals were used to assess the estimate of the odd ratio. The large sample confidence interval for beta p is calculated in this formula. For multivariate analysis, is a technique that allows two or more categories to be analyzed at once. Following our multivariate normal distribution, linear combinations of component of X are normally distributed. All subsets of the component of X have a normal distribution. Zero covariance implies that the corresponding components are independently distributed. And the last one, the conditional distribution of the component are normal. So, RSC curve is a graph showing the performance of classification model at all classification threshold. RSC curve is plotted with two cumulative distribution functions, which are true positive rate and also for false positive rate for all cutoff points. Here is some example of ideal RSC curve and poor RSC curve. Area under the RSC curve AUC measures the entire two-dimensional area underneath the entire RSC curve from 0,0 to 1,1. AUC range from 1, which are perfect discrimination, to 0.5, which is a model with no discrimination ability. Chi-square test of independence is used to decide when a single sample is chosen, two variables are independent to each other. For checking the independence of two variables, the chi-square goodness of fit test may be used. Next, the assumption of chi-square test of independence are the two variables at an ordinate or nominal level should be calculated. Second, two or more categorical independent classes contain the two variables. Also, the steps in hypothesis testing for chi-square test of independent, where the null hypothesis is there is no relationship between two variables, and alternative hypothesis shows there is a relationship between two variables. Method of selection aim is to determine the best model for binary logistic regression. Enter selection method where all the variables in a block are entered in just one step. All the variables must pass the tolerance level, which is 0.001. Meanwhile, forward selection method begins with no variable in the model. Then the regressors are applied to the model one at a time until there are no remaining regressors that cause regression number of squares to increase significantly. For the first entry, f statistic must have lower value than fin. Next, the backward selection, the model begins with all the variables. Then the regressors is deleted with the smallest partial f statistic if and only if the f statistic is less than f out.
For chapter 4, I will explain about data analysis for this study. First of all, I will explain the result from descriptive data. From the gender bar chart, it shows that male patient has the highest percentage with 76.5%. Besides that, most of the patients who undergone CABG surgery did not diagnosed with diabetes mellitus. Also, there are only 41.8% patients who undergone CABG surgery were diagnosed with obesity. However, 67.5 patients are diagnosed with hypertension. Next, majority of the patients who stay in ICU and surgical ward did not have atrial fibrillation and stroke. Furthermore, there are only 126 patients undergone first reoperation and 281 patients has one infection after CABG surgery. Also, only 15 patients undergone second reoperation and almost 6% patients undergone combined surgery. And last, 93.6% patients who undergone CABG surgery did not have chest reopen. Next, we move on to continuous data. The average age of the patient is 54.45 years old, the highest age is 84 years old, and the lowest age is 7 years old. For variable Euroscore, on average, the Euroscore is 2.74, which means that the risk is low. However, the highest Euroscore stat in the data is 20 and the lowest score is 0. Before we proceed to binary logistic regression, we use SPSS to check an outliers. Both variable, age and Euroscore has outliers less than 5%. Since the difference between the value of mean and 5% of trim mean is small, it indicates that the outlier that occur in this study does not affect the analysis of this study. So, this is the slide about binary logistic regression. As you can see, in this study, we compare three different methods, which is enter selection, forward selection, and backward selection, based on their sensitivity, specificity, and accuracy rate. From the table, we can see that binary logistic regression enter selection method was selected as the best model in both model ICU and surgical ward because it has the highest sensitivity, specificity, and accuracy rate on validation dataset. The overall model for length of stay in ICU and surgical ward after CABG surgery are statistically significant by using omnibus test. From the model summary, by using Cox and Snell R-square and Nagel-Karker R-square, the total variation length of stay in ICU that are explained by independent variable are about 12.6% to 20.4%, while the total variation length of stay in surgical ward that are explained by independent variable are about 11.9% to 18.2%. By using Hosmer and Lenicio test, Since the significant value is more than 0.05, we can say that the data fit both model well. Next, from the analysis of maximum likelihood ratio for length of stay in ICU, there are 9 variables that are significant, and this is the estimated model. Next, this table shows the odds ratio for each significant variable in estimated model length of stay in ICU for cardiac patients who undergone Cabg surgery. For length of stay in surgical ward, the estimated model shows that there are only 6 significant variables. Same as previous slide, this is the table for odds ratio for each significant variable in estimated model length of stay in ICU surgical ward for cardiac patients who undergone Cabg surgery. Next, we move to multivariate analysis. First, the ROC curve and area under curve for length of stay in ICU. As you can see from the graph, most of the variables are a good instrument to distinguish the positive and negative value. However, from the table area under curve, variable gender value is below than 0.05. So, that indicates that the model has no discrimination capacity to distinguish between positive and negative class. Secondly, the ROC curve and area under curve for length of stay in surgical ward. Based on the output, which is graph, the results are same as length of stay in ICU, but from the table area under curve, there are 2 variables that has no discrimination capacity to distinguish between positive and negative class, which are hypertension and coronary artery bypass surgery. Last but not least, from the chi-square test of independence, majority of the risk factors are significant with the length of stay in ICU, except for first and second pre-operation. While there are 7 risk factors that are significant with length of stay in surgical ward, which are diabetes mellitus, atrial fibrillation, stroke, wound infection, reoperation 1, combined surgery, and chest reopen. That's all from me. Next, I will pass again to Azifa Husna.
As for the conclusion, anti-selection method is the best model for both model length of stay in ICU and surgical ward. Next, multivariate analysis. AUC values for most variables in length of stay in ICU and surgical ward is significant. On the other hand, gender and few risk factors are not significant. Chi-square test of independence, most of risk factors are same for both length of stay in ICU and surgical ward. Meanwhile, hypertension, obesity, reoperation 1 and 2 are different for both length of stay in ICU and surgical ward. The recommendation for future researcher to predict not just the length of stay in ICU and surgical ward, but also to the other surgical procedure. The model can be benchmarked for doctors to explore treatment alternative to decrease the duration of stay in ICU and surgical ward. And last one, for future researcher, use latest data and fit in the model. Thank you for listening.